What's up, lovely ladies? Welcome to Thyroid Strong Podcast. I am Dr. Emily Kyberd. I'm a chiropractor, movement expert. I help women with Hashimoto's learn how to work out without the burnout. I too have Hashimoto's, but it is currently in remission, and I share lifestyle, food, exercise, root cause changes that I made in my life to help you do the same, to potentially help you put your Hashimoto's into remission. I just landed from New York City. I had 3 wonderful, heartfelt, beautiful days in New York City, seeing clients, friends, and hanging out with my hubs while my mom took care of the kids here, which is amazing. I saw 3 clients on my last day, and I want to share their story with you. I share these women's stories. I will not use their exact names, but I'm going to share their symptoms and their kind of progression to where they got to where they are and share their story with me on Thursday. They are existing patients. They are not new clients. And I share them because all of them have signs of an autoimmune condition. And if you catch an autoimmune condition, specifically Hashimoto's early, about 20% of women can go into remission before there's too much destruction of your thyroid gland, before there's too much atrophy of your thyroid gland. And I think one of the key ways to put yourself into remission is to catch your autoimmune condition early, as well as address the root causes. These 3 women all had early signs of autoimmune conditions. Their doctors were kind of doing the minimal lab work, which I'll share. And each of them had a different root cause, which I think is really important to share. These 3 women all had similar symptoms: gaining weight without necessarily eating more. Nothing else had really changed in their life. Their hair was falling out in clumps, and the embarrassment and the desire to wear a hat and to try everything they can so that their hair is not thinning, especially like in the front and on the sides. Really embarrassing kind of amount of hair falling out. Joint pain that came out of nowhere. So they were seeing me for their joint pain and muscle aches from a biomechanical cause, but also talking about some functional medicine stuff. Fatigue, like way more tired than they've ever felt, crashing at 2 p.m. every single day. And then lastly, this unexplained belly bloat, abdomen bloat. And the sad part was, I asked them all, okay, have you had your thyroid labs checked? All 3 of them had, and all of them only had TSH, thyroid stimulating hormone, tested, which is a signal from the brain. Does my body need more thyroid hormone? Heads up, if you've listened to the past episodes with Dr. Christine Marin, McCall McPherson, who's a physician's assistant who sees exclusively Hashimoto patients, TSH is not enough to give you a full picture of how your thyroid is functioning. So all these 3 women only had TSH, thyroid stimulating hormone, tested. We're going to go through their cases, really simple. And some of these symptoms might sound like, oh, this resonates with me. And I share their stories because I have a live virtual event coming up. It's called the Thyroid Revolution. It's 5 days. It starts May 15th. It's going to be 5 workouts. 3 of them will be Thyroid Strong workouts. So if you want to dip your toe into a Thyroid Strong style workout, now is the time. It's free. 2 of them are going to be how I recover and how I teach my women to recover. And it is not stretching and it is not foam rolling on your days off between your workout days. There's going to be a 2-part masterclass on how to lose weight with Hashimoto's. We're going to talk about eating, working out, sleeping, sleep apnea, and then environmental factors like mold, mycotoxins, parasites, heavy metals, endocrine disruptors, obesogens. It sounds like a lot, but it's going to teach you how to ask better questions from your doctor. So if you want to join the Thyroid Revolution, this free 5-day live virtual event, it's a mix of workouts and masterclass. Go to dremilykyberd.com/rev, R-E-V. Great for the brain foggy Hashi ladies like myself sometimes with kids. REV stands for revolution. So dremilykyberd.com/rev. Starts May 15th. It is live for the people who show up live, for the ladies who show up live for all the events. You get entered into a raffle to either win a kettlebell or a walking pad. My favorite walking pad. It's amazing. They are awesome prizes. Women love joining these challenges for that reason alone. Outside of the challenge is also amazing. So the first patient I saw, we're going to call her Chris. She's a family history of rheumatoid arthritis. She currently struggles. She's kind of always struggled with joint pain that comes and goes out of nowhere. She has extreme hypermobility. She went to a geneticist in New York and did not find Ehlers-Danlos but she is on the hypermobile spectrum. She's currently having histamine reactions like burning skin, burning tongue to everything she eats, runny nose, sinusitis when she eats. She's currently playing with a ketogenic diet, but she feels really limited in what she eats. Just listen up, ladies. If this sounds like you, we're going to talk about what she should start to uncover. Her endocrinologist did a 3-hour deep dive into her medication history because she has taken steroids in the past. She just got diagnosed with vitiligo, which is also an autoimmune condition. And she shared that in her lab work, she has early signs of type 1 diabetes, which is also an autoimmune condition. She also has Hashimoto's. Her endocrinologist did a 3-hour deep dive, which I've never heard of an endocrinologist spending 3 hours, but that's amazing, on her medication history, but never, ever asked about her environmental factors contributing to her load, right? So think of our body as a cup, and every little kind of exposure we get fills the cup. And then at one point, our cup is overfloweth. We might have the genetics for an autoimmune condition, but then it gets triggered by our environment. And so I asked her, when did you start feeling these symptoms? And she's like, I started feeling these symptoms when I moved into a new condo that I bought in the middle of COVID during 2021. And I noticed I felt worse when I moved in. I go, oh, is there any signs of water damage or mold? She goes, no, I don't think there's mold. There is this fine pink reddish dust all over my apartment, in the bathroom, in the kitchen, throughout the entire apartment, that if she doesn't clean almost on a daily basis, and she gets the red fine dust on her skin, it will make her skin itch. She mentioned when she first moved into this apartment, she got full body hives. Hello, that's not normal. She runs air filters 24/7. And if she doesn't, her brain fog, which is kind of like low grade all the time, gets massively worse. And I was like, did your endocrinologist ask about environmental triggers? Mold, mycotoxins. Obviously, this red fine dust could be some environmental factor. Who knows what it is? Maybe there's some heavy metals in it that's affecting her, adding load to her cup. So I go, did anyone recommend a Great Plains Lab toxin test, which tests toxins that are in your body? Did the endocrinologist recommend bringing in an environmental hygienist to test what that red dust is? She's like, no. Heartbreaking, right? So hers could be, because she's seen a ton of doctors. She saw a dermatologist for her vitiligo who gave her medication. She saw an endocrinologist. She saw a geneticist about her hypermobility, kind of addressing the body in parts versus this holistic approach. Her root cause, potentially, that she needs to start to investigate would be, is there toxic load adding load to her cup, to her body, triggering 3 autoimmune conditions? Second client I saw on Thursday was, we're going to call her Maggie. She had bilateral knee pain that came out of nowhere. Hurts to go from sit to stand, both knees. Red flag, ladies. Pain in both knees, not just one or the other, is a red flag that potentially something systemic, especially if there's no mechanism of injury. You didn't fall, you didn't twist, it just kind of came out of nowhere. That's a red flag. If you have that, your little spidey senses should be like ding, ding, ding. She had an x-ray, which she sent me. She had an MRI. She sent me the films and the results. Nothing came up out of the ordinary. Joint space looks good. There's no inflammation of the soft tissue, the bursa. And physical therapy exercises make it worse. So physical therapy was working on kind of functional movements, step-ups, squats, deadlifts, and her knees hurt worse. They regressed, they kind of took back her exercises to banded glute stuff, glute bridges, leg lifts for quad strength. Felt worse. Knees felt worse. She also struggles with fatigue. She's a hard time keeping on muscle mass, and she's currently going through menopause. I go, oh, are you on hormone replacement therapy? Yes, she is. I go, oh, did your doctor put you on hormone replacement therapy? Did they do a follow-up test just to make sure your hormones are in a good place? She said no. No? Really? No? I asked her if she had her thyroid labs done. She goes, oh yeah, they did a comprehensive thyroid panel. That's what they called it. I go, great, let's see it. All they tested was TSH. Bilateral knee pain, no mechanism of injury, movement makes it worse. She's going through menopause. I was like, girl, we need to see a full thyroid panel, sex hormone panel. Let's check your autoimmune markers and your inflammatory markers. Menopause, Hashimoto's symptoms overlap with those 2 conditions. And It's important to work with a provider to get both your thyroid hormones and your sex hormones optimized so you can feel like your best self. All her symptoms are getting addressed from a biomechanical perspective. And I am a biomechanical doctor. I see biomechanical pain, injuries, overuse injuries. This to me, my red flag spidey senses, like this is not biomechanical. PT is making it worse. And they're doing kind of what a typical PT protocol would be. Trying to improve function of daily living, trying to get strength back. Something else is going on. So I told her to get more labs. The last client, we're going to call her Angie. She has a history of being hypermobile, low muscle tone. Notice this is a commonality among all three women. She got in a car accident in November. She broke her left arm and left leg, major surgery. Like there was so much swelling in her knee that they could not do surgery for 3 days. Her tibia was shattered. She broke her radial head in her arm. She has like a fake plunger radial head. Big, probably like 6-inch scars on both her leg and her arm. Could not do surgery for 3 days because if they cut her open, there was not enough skin and there was so much swelling, they wouldn't be able to bring the skin back together. So they had to wait 3 days to do surgery on a ton of pain meds, morphine. And since November, in a wheelchair for 6 weeks, on crutches for 6 weeks with a cane, really inactive. But now she's back to working out, going to physical therapy 5 days a week. And here's the thing. She has always had a regular menstrual cycle. Since the accident, she lost her menstrual cycle in November. So November, December, January, February, March, where are we? April, May, 7 months, no menstrual cycle. Her hair is falling out in clumps in an embarrassing way. She wants to wear a hat. It's kind of like on the front and the top, somewhere where someone could see. And she can't lose weight. And her thyroid gland is enlarged. So when she swallows, she feels like a click or a fullness. She feels almost like someone's choking her from the front. Talk about creating a sympathetic response, right? Like a fight or flight response if you're constantly feeling like you're getting choked. So she did have major trauma. I asked her, did you have your thyroid labs done? Obviously, with the swollen thyroid gland, they did an ultrasound. It was inconclusive. They checked TSH and T4, not free T4, just T4. It does not give you a full comprehensive picture of what is going on with your thyroid gland. So I asked her, hey, let's get your sex hormones, inflammatory markers, autoimmune markers, a full thyroid panel, checking for antibodies. Probably the trauma is a big root cause that she's going to have to do some somatic work around and some therapy around. These are 3 different root causes in 3 different women, all with early signs of autoimmune conditions that are kind of being failed by the conventional medical system. And I am all for conventional medicine. I'm like so grateful we live in a country where we can have surgery and get the help we need with traumatic events. But I find that women like these 3 women that I saw, like they're not getting the labs they need. They're not getting the answers they need to potentially catch their autoimmune condition early, to potentially go into remission or just to like feel better. So I bring these up because if we ask better questions from our doctors, we will get better answers. But we need to know what questions to ask. So that first client who has red dust all over her apartment, she was like, hey, what test should I get? Maybe this red dust is affecting and triggering 3 autoimmune conditions. What test should I get? Who should I see? How could I pick up and see what if this red dust is affecting my body? So if you ask better questions, you will get better answers. And I am not blaming these women. I've seen them for many years. I adore them. It's not their fault, right? Their doctors are missing the mark. And this is why I share these stories because we all want to feel like ourselves. We want to feel like our best selves. No one wants clumps of hair falling out as they're sitting at their desk. No one wants like belly bloat and weight gain. We want to move through this world with like a strong body and a clear mind and an open heart. And it's hard to do that when we're kind of getting run through the medical system from doctor to doctor to doctor, not getting answers we need. So what is my solution to this? I gave them labs that they should ask their doctors and hope that they can get them. I gave them functional medicine doctor recommendations, which is a little bit trickier in New York City because there's more regulation around testing outside of kind of traditional conventional testing. And I was like, you know what? I have this thing coming up. 5 days, starts May 15th. It's called the Thyroid Revolution. It is a 5-day free um, virtual event. And we're going to work out. We're going to do some recovery workouts. And then there's going to be a master class to teach you how to ask better questions from your doctor. We're going to talk about how to lose weight, specifically with Hashimoto's, because I know that's the number one struggle for women. And we're going to talk about how to eat, how to work out, and then these root cause factors that conventional medicine doesn't talk about. Mold, mycotoxins. Conventional medicine doesn't even acknowledge that mold exposure is a thing. It's not seen as a diagnosis in conventional medicine. Mycotoxins, parasites, heavy metals, environmental factors, like pesticides, endocrine disruptors, obesogens. So it sounds like a lot, but if you get better at asking the right questions, you will get better answers. You will probably feel better quicker, especially if you do not have the financial means to see a functional medicine doctor, right? Functional medicine doctors can run from $6,000 to $15,000. That doesn't even include the testing. So I'm teaching you, and it's free, and it's everything that I learned on my journey, putting my Hashimoto's into remission, as well as losing 40 pounds of postpartum weight twice, living with Hashimoto's. So if you want to join, go to dremilykeiber.com/rev. We're going to talk about some labs. dremilykeiber.com/rev. If you show up live for all the events, even if you show up for one, you will get so much out of it. But if you show up live for all of them, I'm going to have a way to track who shows up. And you get entered into a raffle to either win a kettlebell to start that workout journey, especially with summer coming, or a walking pad. So, ladies, I hope these stories kind of resonate. Like some of you might have thrown your hand up and be like, oh my God, that is me. This is my solution for you, and it's free. So check it out. Thyroid Strong 5-day live virtual event. It's called the Thyroid Revolution, and it's really to help you ask better questions from your doctors. dremilykeiber.com/rev. All right, ladies, I hope to see you there. We start May 15th, which is in a week and 3 days. And, oh wait, no, it's in 10 days, which is in 10 days. And it is really kind of all my work that I've done on myself, the work that I do with clients in person, and the work that I do with women online inside Thyroid Strong. And you get to get like a little taste, a little dabble of it. All right, dremilykeiber.com/rev.